with the condition, I was already healing when I started to do the Cure program, and I'd already come quite far.
Right.
So
your symptoms were disappearing. That was what you tested.
Yeah.
And they're probably going to continue to disappear no matter what you do. The
Yeah,
Cure program or whatever else you do. They're going to disappear.
Because it's like you said, it keeps going. You keep going at curing. It's not like there's one definitive blast everything away. I think that the curing stages can be quite delicate and quite seamless, you know, so the improvements, it's almost like you just blend into a better state.
Let me ask you a question. I want you to test this. Now hold up your hand. As you were saying, you don't get signals through your hands. Or you get they're like bodily sensations.
And the other thing is you might notice on yesterday's, for example, I get like often like my eye will flicker twice or something like that.
So 2 means yes?
Yeah, but it sometimes can be once or twice or 3 times. I'm just saying my eye reacts quite a lot, but not always.
Okay. Now, are you getting any of these signals right now?
Yeah, at the moment I'm getting them in my hands.
Okay, what are those like?
They're kind of like little electrical currents flying through my fingers, you know, like one there, one there, one there.
Okay.
They're sporadic.
What do those signals mean? Right now, the ones you're getting right now, what are they telling you?
That I'm alive.
Okay. Anything else?
And I'm connected to a bigger energy source.
When you
connect to other things.
So when you say that, when you say I'm connected to a bigger energy source, do you get a little special signal like through your finger that you are? Does one come right then as you're saying it?
Yeah, I blinked and I got a signal in my finger and I got one here.
Okay. Just pull your camera down now, so pull your screen forward so that the top of your head is sort of touching the top of the screen. No, I mean by that, don't move the computer. Just pull the screen forward to lower the camera angle. See? So don't touch the computer, touch the screen so that the camera angle changes.
I can't, otherwise the whole computer will fall onto me.
Oh dear! Well, we wouldn't want that. We don't want that, do we?
Don't do that. This is I think the best I can do without having an accident.
Now, okay, relax and sit back. Now I want you to test something else, okay? Mm-hmm. Also, I think it's too close to you. Like, just push it back a bit, yeah, so that you know. I want you to test when you lean your body forward. Is that from tension? See if you get a signal on that.
Yeah.
Okay. Now,
I know I particularly do it in my right side a lot, which is probably why I have so much pain in my right side.
So test, is that one of my symptoms?
Yeah.
Is that a symptom of fibromyalgia?
Yeah.
So, this is another movie about curing fibromyalgia. Test this question. Have I cured my fibromyalgia?
I got a yes.
Now, test, do I have fibromyalgia in any of my bodies?
Yes.
So, obviously you can cure something and still have it.
That's what I'm discovering every day, yeah.
Because, you know, curing something in, like, you know, if you take something out of your DNA, it can still be in your gravitational body and go back to your DNA from your gravitational body, and then you've got the whole thing back. But it doesn't mean you didn't cure it. It just means that you got to keep working. So cure is not what people think it is.
Yeah.
Because people see cure as a final and complete eradication of something that will causes it to never come back. They not only see it as getting rid of the thing, but they see it as total immunity. And, you know, there may be such a thing. For example, have you ever cured the flu?
I've cured many of the viruses, but then when I've checked, they've still been there, so yeah.
Well, I never got another flu. I stopped getting the flu in 1993. I've never had another flu.
Right.
No colds, no flus for this entire time, almost 20 years. I used to get 3 a year. And so, obviously, in my case, I've done something that caused me to have this thing that people call cure regarding colds and flus. You know, it's total immunity. I never get it. I never find it in any of my bodies, and I never get the flu. I never get sick.
Yeah, since I started doing different forms of energy work, I haven't had the flu, which, you know, has been about 2 years. Because I've noticed everyone around me getting sick. So it was like I had...
You know, there may be a similar thing with fibromyalgia, with herpes, with cancer, you know. There may be something like what we experience with flu with anything.
Yeah.
And that's pretty much what we're working towards. We work towards complete immunity and total cure. That's our goal.
That's great.
We always knew that book would be good for something. Well, okay, back to, in your estimation, just without testing it, have you reduced your fibromyalgia symptoms at all?
Yes.
Now tell me about that.
I've tested it, but in my estimations I'd say yes.
Well, how did it used to be and how is it now?
Physical symptoms are still pretty much the same, but mentally I wasn't coping with what was going on. I had a lot more fear, a lot more worry, a lot more head chatter, a lot more delusions. You know, the way I perceive things were a lot more kind of, I was sure all the time that things were going to remain in a really bad way for me.
Well, but you're actually saying that things are still in a bad way with you, and that your physical symptoms haven't budged. Basically, isn't that your?
I am, but I'm saying that mentally I'm feeling so good that I cope with it. Well, more than cope with it. I don't see it as a problem. That's what I'm saying. I have ultimate faith that they will go because I'm curing it and I'm doing all the right things. But I'm not blaming them anymore.
Well, I'll tell you what. For most people hearing this, they would not even see this as a result. They would just say, well, it's great that she changed her attitude, but I'm looking for a cure. And they would just move on, get back on the web and look for what can I do for fibromyalgia, because obviously from what you're saying, what you're doing is not working. To them, it's obvious to them that it's not working. But I'd like
it's a massive thing, and obviously it depends on, with the fibromyalgia, what other symptoms they had. For me, PTSD was such a large part of it that the things that you're battling with in the day to cope with doing simple things like making food, if mentally you can cope with what's going on, you can cope with anything.
Well, what is do you know what the post-traumatic stress disorder stemmed from?
It actually, it fired up after a car crash.
And the car crash, okay, so the car crash was sort of like, let's say you had a predisposition to it, and then you got in this car crash, and then you had fibromyalgia.
Yeah, and if anything, it was, you know, I'd say that I've always had a certain amount of post-traumatic stress because I've always been super emotional, super sensitive.
Right, you were predisposed, yeah.
Yeah.
You were and then you got in a car crash.
Yeah, the car crash forced me to get to know myself and what I'm thinking.
Well,
and it also forced me to face why I had the car crash.
Okay, now see if you get a signal on this, okay? Mm-hmm. Test this question: have my physical symptoms from fibromyalgia decreased since I've started curing it?
Yes, I've got a signal, yes.
So you actually get a signal that they have, but they seem to be just as bad to you.
Yeah. Yeah.
So how do you explain that difference between the signal you're getting and what you know about yourself, that your symptoms aren't changing?
Because the main change that I've seen was that once I didn't have the wall in my mind that because I have fibromyalgia I can't run or cycle, once that wall came down and I started to jog and cycle, my legs got stronger. And that,
so in other words, what you're saying is that you now,
that was an improvement.
Where did you get the diagnosis of fibromyalgia? Did you get it from a doctor?
Originally I got it from a chiropractor.
Okay.
I suffered with post-traumatic stress over a long period of time, and then an adrenal burnout and a bunch of other stuff. And then I had physical symptoms down the right side of my body. One day I was lying down doing yoga and the base of my spine kind of gave in and I couldn't sit up. I saw a chiropractor. He said everything made sense, whilst all the doctors had been ignoring me. They were just saying, oh, it's nothing, take some antidepressants. I was not getting diagnosed, which is very common here with the the national health system. So with this condition, I was not getting diagnosed. The chiropractor said to me, this all makes complete sense. And after my third treatment with him, he used a massage machine on my back.
Right.
And then, bam, overnight, I was walking like someone with Parkinson's. I couldn't do this. I could only literally do that. All my joints stiffened and seized up. And that's when fibromyalgia began for me.
And your joints are no longer stiff?
No, a lot of that I cleared already with other healing modalities.
Well, so what you're saying here is this sounds like what you tested. That you tested that your physical symptoms have been disappearing possibly for years or months. Your hands are moving, you're cycling, you're jogging, and so your physical symptoms are disappearing, but when you're asked a question about it, you say, no, my physical symptoms are the same. That's funny, isn't it? You know, that would be obvious to anybody watching this movie that somebody whose hands were paralyzed and who couldn't walk and who's now jogging and cycling and who's moving her hands, the symptoms are disappearing. And yet the story that you tell is that they're all the same. Nothing worked.
What I'm saying is that
it's just your attitude that's changed, according to you.
But I would say with the condition, I was already healing when I started to do the CureProgram, and I'd already come quite far.
Right. So your symptoms were disappearing. That was what you tested.
Yeah.
And they're probably going to continue to disappear no matter what you do, the
Yeah,
CureProgram or whatever else you do. They're going to disappear.
Because it's like you said, it keeps going. You keep going at curing. It's not like there's one definitive blast everything away. I think that the curing stages can be quite delicate and quite seamless, you know, so the improvements, it's almost like you just blend into a better state.
So now you're talking about what it is to cure fibromyalgia and have the symptoms disappear.
And the other thing is that, I once took a homeopathic remedy for this, because the two homeopathic remedies for this are depending on how the person with fibromyalgia deals with the pain. And the thing they asked me was, is the pain better for movement? And I always said yes. If I walk, and I've always walked a lot with my fibromyalgia, everyone said, yeah, but doesn't it hurt? And I said, yes, but the walking makes life better for me. When I sit still and I can feel it, that's the horrible part. So for me, the jogging and the cycling is better for me, because in a way my mind doesn't really think about it. When I'm sat still, I can feel it.
So now you're talking about what it is to have the symptoms of fibromyalgia disappear out of your life. The physical symptoms disappearing.
Well, they haven't disappeared because they're still there. I can still feel them.
You can still feel them, but they are in the middle of like you can feel them, but your hands also are moving instead of being paralyzed. Yes?
Oh, yes. Definitely.
So that means the symptoms are disappearing, am I right?
Yes.
So that's what you're talking about. You're describing what it's like to have the symptoms have been disappearing for months and months. Since the original time when you were walking like you had Parkinson's. Right?
Oh, yes. Yes. I understood the question was, since I started doing the curing with IMMUNICS.
Well, you were doing the curing with EFT and
exactly.
And other things, you know.
Yeah. So yeah, changes. I also did a lot of muscle work on myself, just like pushing into areas of pain and stuff, which actually at some point I stopped because it was a horrific experience. So I released a lot of my own pain. I did a lot of extreme things because it was so hard for me. I hated the pain. Actually, I hate pain anyway.
Did that help you when you did it?
It released stuff, but I had huge healing crisis and it was horrible. It was scary. I thought I was going to die. So, I mean, like lots of fear came up, so I stopped it.
So emotionally, you had a problem with doing it, but you say now your emotions are feeling much more manageable.
Oh yeah.
Easier for you. So maybe you could go back to doing that now, and you wouldn't be afraid when you went through a healing crisis. Maybe you'd be okay with it.
Healing crisis with this condition have just been horrific. So I'm leaving it in the hands of going gently. I promised myself to go gently with myself, generally. But I also realized that I had a phobia of pain, like blood, needles, knives, all that stuff.
So test this question. Hold up your hand. Has my phobia of pain disappeared?
No.
Okay. So now just say I'm removing all phobias. And when you get a signal, you've done that. And tell me when that happens.
Okay. Yeah. I got a signal.
Do you feel any different?
I feel some relaxation, and I feel some sensitivity in my bottom teeth, which I often get when I cure stuff.
Is that a good thing?
I presume so. Often when I cure like lots of stuff and I really sink into the calm, clear place, I often feel like my entire head at this point like throbbing. Or like something here becoming very alive as well. So I think it's a good thing. Not that I want to feel it, the pain. No, it's like a sensitive feeling, not a pain. I know that the teeth are connected to meridians, aren't they? So I always presumed it was something to do with that.
Well, test. Is that what it is? No signal means no.
Yeah.
It is?
Yeah.
And is that a good thing?
Yeah, yeah.
Okay, so you now know a little more about it.
Mm.
It's a good thing. It's connected to meridians. It's, you know, if you want to learn more about it, you could ask more questions. I don't know, you know, if I feel like doing that right in this movie, because our listeners might not be that interested in learning about meridians right now. But, you know, if you have an interest in meridians, that's the nice thing about testing. You always have it. Like, it isn't about doing a session with me. It's just you can know anything by just walking around asking questions and getting signals. So you can learn all about your meridians if you want.
I am, yeah. I've been looking at the lessons on the hub, and I'm learning a lot through books.
What's the difference between what we're doing here and doing one of your EFT sessions that you sell to people in your workshops?
EFT. With EFT, particularly the method that I use, which is more about sensing the energy rather than using the traditional words that you repeat, I can tap on my face without going back into talking about any of the trauma or anything. And often until the visual or the thing that I sense has disappeared. I can often release things that way. And with IMMUNICS, it's about making inquiries, asking questions, and then following the thread to cure and remove things.
Well, what is the immunic response?
A signal.
In what kind of signals are we talking about?
The signals are like a twitch in the body, or what often to me feels like a pang inside of me, you know?
Remember a minute ago when you said that when you removed the phobias, and I asked you if you felt different, and you said that you felt different, right? Do you still feel like that calmness right now? Are you still there? Are you still in the calm, clear place? Or did that pass?
I think it's past.
Okay. Test again. Do I have any phobias?
Yeah.
See, what happened was a phobia is an adaptive behavior. It's something you do. You adopt phobias as a way of adapting, and you adopted more phobias within minutes after taking them out. You grabbed them. You recreated them instantly. You took them out, felt better, but you didn't care about the good feeling. You needed the phobias, so you grabbed them back. Now, I don't mean you really needed them in some objective sense. I don't want you to get the wrong idea. What I mean is in your deranged and twisted mind, you need your phobias. In your delusional state, you know, of consciousness that you live in, you need your phobias. Okay, so you immediately readopted them.
Yeah. I have been fascinated by this idea of people not actually being able to heal or cure things because they're used to having them.
Well, it isn't that you're used to it. You actually, you know, and another thing, like,
or part of you wants them.
You know, well, it's not part of you. It can be your spiral body wants them.
Right.
See, like what your gravitational body does is your gravitational body zooms around and reads DNA codes in other organisms. That's what it does. That's its function. Do you know anything about, oncology?
No.
Well, genes grab characteristics from other organisms, grapefruits take characteristics from orange trees, and you get this orange grapefruit like the one I had in my front yard before it died. Get it? The organisms are always doing that. They're always grabbing their DNA, and nobody knows exactly how they do it. But how they do it is the gravitational body goes and gets the codes and inserts them in the DNA of the other thing. Get it?
Right.
See? So that's how flounder DNA ends up in strawberries, other than that, actually an oncologist puts it there.
Okay.
They actually insert it, manually. But, the fact is that things are always grabbing DNA codes from other things. And so when somebody has cancer and they cure it and then, a few hours later they've got it back, it's always for the same reason, the reason it was there in the first place, that their gravitational body believed that it was something they needed. And actually it may be true that at some time in the past it was something they needed, because they may have been a different life form where a DNA code like that was very useful.
It was useful because, is it protecting them?
Suppose you lived on Mars, like 30 million years ago. Suppose you were a Martian, and you didn't look like this. You had a completely different kind of body, and that kind of body ran on those codes.
Okay.
See?
Okay. So it's potentially it's past life as well.
It's not really even a past life. It's a past existence.
Past existence.
They're called impairments and disabilities, and there are lessons on them.
Okay.
And the impairments and disabilities that you're looking for are the upper dimensional ones. Like impairments laid in above the 27th dimension.
I don't quite know what that means.
No, because you haven't done very much work in the web college. But once we're able to hook you up with several other people on a computer with a movie, and we all work together that way, that's what you're going to be doing, is working in the web college with Barb, Greg, Ross, whoever, with me supervising. And that's why you need the equipment and the internet connection.
Sure.
And we can film that, and you can learn about and actually cure things from that perspective. But right now, what you can do is you can just say, okay, I'm now removing all my phobias. Again, just say it again.
I'm now removing all my phobias.
Taking it more seriously this time, aren't you? I can see there's this certain determination in your voice, like this time it's going to work,
I'm thinking, I don't completely understand. What do I need to do to keep them out?
Quite a lot, probably. However, the other answer is you need to stop readopting them. So there's two answers. One is quite a lot, and the other is stop readopting them. Get it? So right now, just take them out, because when you take them out, you're actually training your bodies and yourself to not adopt them. It's sort of like, it's a training, you just, a little kid touches the thing again and you say, no. And he whips his hand away, and it's like, okay, I'm learning, don't touch the hot stove,
So then after a certain point, does the behavior to not adopt them just get easier and that they stay out?
See, you have to realize it's not a behavior. It's an absence. It's an absence of a behavior, and absences are very difficult for people.
Yeah, because what happens in the absence of an old behavior? You have to put something in place, I guess.
Well, it's much easier to adopt a behavior. For example, test this question. Is it good for me to do things that I have phobias about? That I'm afraid to do? Is it good for me to do those things?
Yes.
Sure, because then that's the real training, not to adopt phobias. Instead of adopting a phobia about the behavior, you just do the behavior.
Right. Okay. So facing the fears.
Now, hold up your hands again and test, have I cured any of my fibromyalgia during this interaction?
Yes.
Permanently?
Yes.
I don't know if you can test permanently, but I just thought there's no harm in asking, even if the test is not really a valid test, I mean, maybe it's impossible to do anything permanently, but
Yeah.
But, at least, if you get yes, it does mean something. It does, the test has meaning. But what it means, you see, I remember when I was asking you what your signals meant. Well, in a way, it's impossible to know what signals mean. And in another way, it's very useful to try to know. Do you understand?
To get to know the signals.
To try to, just to try to know what permanently, did I cure that permanently? Well, what does that mean if did I cure any of my fibromyalgia permanently? Is it something I'll never readopt? Tell me.
I think I'm getting it potentially that when my left eye flickers and the left side of my lip sort of quivers inside, that this is a stronger yes, potentially. Mm-hmm. Do you mean like getting to know your signals like that?
No, I mean to understand what they mean. When it says permanently, does it mean that it's not any longer an option for me to adopt that? Because test this, is fibromyalgia an allergic reaction?
Yeah.
So allergic reactions are things we adopt also.
Okay.
I removed an allergy once and it never came back. It never came back. And it was a very physical thing. It was lip cracks. And I removed it. I never got another lip crack. In the winter, I was getting cracks in the corners of my mouth. My cracks were healed by the next morning and I never got another lip crack.
Right.
And I've been getting them my entire life. I've been getting them all my life. Every winter I got them. My entire life I got them. I thought they were normal. They weren't normal. They were an allergic reaction to fruit pectin. And I went right down, as soon as the cracks healed, I went right down and ate a pineapple in the dead of winter. It was 20 degrees. And I had bought a case of pineapples, which is what I got the lip cracks from. And I went down to see if they would, and I didn't get a lip crack. Over the next few days, I ate the entire case, never got a lip crack from them.
I see. Okay. So that's good to test them, right? Yeah.
See?
Find out how to test them as well, I guess.
Yeah, that was a permanent cure, you might say, if indeed you can see something as you adopt as a cure. But anyway, test this question. Have I cured some of my fibromyalgia during this session? Didn't I just ask you that?
You did ask me, yeah.
And you got yes on it. Okay, I forgot that I asked the question already.
and my left leg just jumped.
So you got another signal. So it's good to test it again.
Yeah, and I'm yawning a lot more now, which is often, I think, a sign of when stuff's moving.
Yeah. So you're getting a yawning is good, right?
Yeah.
You look tired. What are the hours in which you sleep at night?
I'm having bad sleep. Where I live can be a bit disruptive, so.
I want
it can disrupt my sleep. I'm sleeping in a room with a fridge, and the past couple of weeks has been quite like verbally violent on the streets. There's been a lot of people shouting, things like that. So I'm just a bit unsettled. But
test this. I want you to test something.
Okay.
Test this. Would magnesium help me?
I got a yes, and I'm having magnesium. I'm having extra. The past 2 weeks I've been having extra everything of vitamins and minerals.
Okay, one thing is, do not take any calcium.
None. I thought I needed calcium with magnesium.
No. Don't take any calcium.
Just from foods.
Yeah. Well, everything's got calcium in it, right? Okra has calcium. Romaine has calcium. Spinach, calcium. Chickpeas, calcium. Beans, calcium. You know, you name it. It's got it. And do you eat dairy?
No.
Okay. So, but you'll get calcium from everything else.
Yeah, vegetables mostly.
Yeah, vegetables and also beans have calcium.
Yeah.
Tofu is very high in calcium.
Yeah.
So, but cut back on foods that have calcium too, and take the magnesium. And you notice your yawning means that you're not hyper anymore. Do you feel like you might even lie down for, like, if you lay down right now, might you sleep for a little while, like 10 minutes? I'm not saying you should do that, but
yeah, because I get really hyper.
Yeah, because you have cured something, and now a lot of people, this is, by the way, a very normal response when people do this, is that they just feel sleepy because they're dropping all their defensiveness.
Yeah, I am.
That's what's wearing you out.
Mm.
You're wearing yourself out by defending yourself.
Okay.
Now, I wanted to ask you, I think that we should do something with your abuse trauma. You know, do you feel okay about curing the effects of your abuse on YouTube?
What abuse specifically?
Well,
anything that I test for?
You were talking about abuse in another movie, but we never actually got into curing it.
I'm not sure if I do yet.
Okay, because the thing is, number one, I think it might be one of the causes of your a major cause of your stress. Another is that there are a lot of people who have abuse. It's possible that everybody who has fibromyalgia was abused. I was testing that. Actually, I tested that everybody who has fibromyalgia is an allergic reaction to abuse. It may be.
No. I did already do some testing, but I had a lot in other lives. Like I've had it as a repeated.
Well, you need to do this with other people, not by yourself. Like, it would be good to have Barb on, you know, and me listening and coming, you know, guiding you both through it. But it's better to do it with people. It's just something that's, when it's major like that, it can be very hard to do it all by yourself. So I think that you ought to do whatever you need to do to get ready to do that.
Okay.
Because for one thing, you know, you could help a lot of people are afraid to talk about their abuse on YouTube or on Oprah, you know, or on Dr. Phil. You ever watch Dr. Phil?
No, we don't have that here, as far as I know.
Yeah. Okay. Well, anyway, you know, there are these programs where people work on those things. They don't really cure things the way we do, but it does help them. But a lot of people are, you know, afraid to do that, and, you know, they don't cure it. So I think that it would be, you know, good for you to get yourself into a state where you can handle that, because it's going to be hard for you to help people if you can't help yourself. You know, if you're just not ready to, you know, help yourself. Okay, so be with that. We don't have to you know, you don't have to handle that right now. Can you see some new behaviors that it would be good for you to adopt?
Meeting people from the Cure, you know, or the Facebook community of IMMUNICS on Skype now that I'm set up.
Yeah.
That would be a really good one, because then I can do it with them, they can do it with me, and I start to use what's on the hub.
Yeah. Okay.
Yeah.